My name is Rita Marsh. I'm with the Center for Human Flourishing in Carbondale, Colorado. And I'm here with Dr. Greg Feinsinger to present to you his program on prevention of heart attacks. Thanks for being available this morning, Greg, for recording your program. I know that this is going to reach many people, and I'm grateful that we could do this together. So proceed. Thank you.
Well, thank you for asking me to do this. It's my pleasure. So I was a family physician in Glenwood Medical Associates in Glenwood Springs, Colorado for 42 years. And in 2003, I found out that the most common cause of death, heart attacks, are totally preventable. So I started a heart attack, stroke, and diabetes prevention center at Glenwood Medical, and that's most of what I did the last several years of my practice. I retired 6 years ago. I learned nothing about nutrition in medical school or in conferences that I went to in practice until rather late in my career. I found out about the power of food. I found out that health is not just all about pills and procedures, but that a plant-based whole foods, meaning unprocessed food diet with no salt, sugar, or added oil is the most powerful tool that we have to prevent and treat and even reverse most of the chronic diseases that people in Western society suffer and die from. Now, 2020 was not a usual year in that sometime during November, deaths from COVID surpassed those from heart disease. But in most years, it's all other years, basically, for going back several decades, the most common cause of death has been heart attacks. In 20% of heart attacks, the first symptom is the last, sudden death, before people even get to the hospital. So why don't we prevent heart attacks? Well, a lot of it has to do with follow the money, like so many things. This big industry has been built up that looks at heart disease as a plumbing problem with blockages that need to be fixed by stents or bypass procedures. Instead of medical disease that's preventable and treatable and reversible just with simple lifestyle changes. Our medical system is based on disease management, not on disease prevention. So instead of preventing diseases, we wait until they occur, and then we spend a lot of effort and money trying to manage them. So here's the problem. There's the two desks here, and there's a big line waiting to get to the desk about toxic pills and surgery, and there's nobody at the lifestyle change line. So when it comes to our health, what do most of us want? So I think we want to live to a ripe old age, as long as we can enjoy a good quality of life with our mobility, our mind, and our vision intact. Ideally, we'd like to be healthy up until a few hours or days before we die, instead of the slow downhill course that so many Americans face, starting in their 50s and 60s, with more and more pills and more procedures and more doctor visits. So what do people die from in this country? As I said, in normal years, other than COVID years, it's heart attacks and strokes caused by hardening the arteries, also known as atherosclerosis. Number 2 is cancer. Number 3 is medical errors and complications from our medical system. Just for example, over 100,000 people die every year from side effects from prescription medications. So what are the common causes of disability and poor quality of life? Because it's not only how long we live, but a lot of it is our quality of life as we age. So number 1 is strokes. So if you go to most nursing homes, a lot of the people there have had a stroke, and they are paralyzed on one side, they can't talk, it's not a good quality of life. Number two is diabetes. If you have diabetes very many years, you're apt to have eye problems, which can lead to blindness. You're apt to have cardiovascular disease, namely heart attacks and strokes. You're apt to have kidney disease, which can lead to kidney failure and dialysis. You're apt to have dementia and Alzheimer's and other forms of dementia. I'm sorry, so diabetes, I guess there's no way we can reverse this. So diabetes, you're apt to have kidney problems and you're apt to have nerve problems in your legs, namely chronic pain and numbness, which can even lead to amputations. So number three, as a cause of disability or poor quality of life, is Alzheimer's and other forms of dementia. Number four, mobility problems, often related to diabetes, and then vision loss from macular degeneration, as I mentioned before, diabetic retinopathy. So heart attacks and strokes, what's the cause? So again, heart attacks and strokes are caused by atherosclerosis, hardening the arteries. So in our country, most people end up with atherosclerosis as they age. So it's very, very common, but it's not inevitable. If you look at places like the blue zones in the world, where people live particularly long lives and they're good quality lives, their arteries are the same at 90 as they are at 19. They did not get hardening the arteries and they're heart attack proof. So hardening the arteries, in addition to heart attacks and strokes, can cause peripheral vascular disease, which is where you get blockages in the arteries in your legs, which can lead to amputations. Chronic kidney disease, the main cause is hardening the arteries. Erectile dysfunction, the arteries in the penis are very thread-like and small, and they are the canary in the coal mine as far as trouble with your vascular system elsewhere. And dementia is probably going to end up being a vascular disease, although we don't know that for sure, but at least the risk factors for dementia such as smoking and high blood pressure and diabetes and so forth are the same as the risk factors for heart disease. The earliest signs of heart disease can occur in young children. So what we feed our kids matters. So let's talk about the endothelium, which is an organ system that lines our arteries. So depending on what we eat and whether or not we exercise, the endothelial lining produces nitric oxide, which dilates arteries, enhancing blood flow. Nitric oxide also keeps arteries healthy and free of plaque. If the arteries get stressed by things like bad genes, by bad habits such as smoking or lack of exercise, or conditions like high blood pressure, diabetes, and high cholesterol, the endothelial lining starts to thicken and eventually it develops plaque, hardening the arteries. So what causes atherosclerosis? So first of all, the SAD. So SAD stands for SAD, but it also stands for Standard American Diet. Number two is genetics. So if you have a family history of people developing hardening the arteries in their 50s and 60s and even 70s, then you're at higher risk. High blood pressure is another one, high cholesterol, diabetes and prediabetes, sleep apnea, any kind of stress, which includes depression, anxiety, and sleep problems, sedentary lifestyle, inflammation, and smoking. So I'm going to talk about several of these risk factors separately. So let's talk about inflammation. So people with inflammatory diseases such as rheumatoid arthritis have 7 times the risk of having a heart attack or stroke compared to people that don't have that kind of disease. For most of us, inflammation comes from dental issues. So good dental hygiene is very important. And if you have gum or tooth problems, it's important that you see a dentist, and hopefully a dentist who understands the mouth vascular connection. Hypertension, which is also known as high blood pressure. So the systolic pressure is the upper number of your blood pressure, which is when the heart is contracting. The diastolic is the lower reading when the heart is relaxing. So your blood pressure should be less than 120/80, except in perhaps a very frail older person, and sometimes those people do better with a slightly higher blood pressure. And as far as treating high blood pressure, the best treatment is to attain and maintain ideal body weight, and particularly avoid salt and avoid animal products, and to eat a plant-based diet. Sometimes medication, of course, is needed for high blood pressure. How about cholesterol? Now, there are some cholesterol skeptics out there, and if you look at the internet, there's a lot of misinformation, including that cholesterol doesn't play a role in heart disease, but it clearly does. There's no question about it. There is a disease called familial hyperlipidemia, where people, for genetic reasons, have very, very high cholesterols, like over 300. And sometimes those people have heart attacks and die in their teens. Now, the cholesterol skepticism comes from the fact that half of people who have heart attacks have normal cholesterol based on what we call normal. But the problem is we're not calling the right thing normal. So we say, the standard in this country, the guidelines say that your total cholesterol ought to be less than 200, and your LDL or bad cholesterol ought to be less than 100, and your good cholesterol or HDL should be greater than 40 if you're a male or postmenopausal female, or greater than 50 if you're a premenopausal female. And your triglycerides ought to be less than 150. The problem is that's based on what the average American has, and the average American is going to die from a heart attack. So people who are into heart attack prevention, like I am, say, why would we call that normal? What we ought to be calling normal is what the people in the blue zones have, for example, who are heart attack proof. So those people tend to have total cholesterols less than 150, and LDLs or bad cholesterols in the 30s and 40s. So think of L as lousy. So think of LDL or bad cholesterol as garbage in your arteries. So if you're going to have too much garbage, you're going to have a problem with your arteries. Think of H as healthy. And so think of HDL as garbage trucks. So you're also going to have a problem with your arteries if you don't have enough garbage trucks. Triglycerides in people in the blue zones are less than 70. So not just less than 150, but less than 70. Now, another important factor is LP little a is what we call this. So capital L, small p, and in parentheses, small a. And that's a particularly harmful kind of bad cholesterol. And that should be tested. It's not tested in a regular cholesterol panel that you get in a doctor's office or hospital or health fair. But it's very inexpensive to check for. And if it's elevated, then that's a huge risk factor for heart disease. And we often see elevation of Lp(a) in families with a lot of heart disease. It's never been proven that lowering it actually makes a difference in your risk for heart attack, but we do know that a plant-based diet does lower it, and niacin does as well. But as a heart attack prevention doctor, when I see somebody with a high Lp(a), I want to treat the things that I can treat, such as their LDL or bad cholesterol, and I can get that 10 to a very low level, like the less than 50, and that's my goal for that patient. And then another thing about cholesterol is that normally what we measure in a health fair and so forth is a level of LDL, but what's much more important is the number of LDL particles per unit of blood, and we call that the LDL particle number. And that's easy and inexpensive to test for as well. Another important thing is the LDL size, the size of your bad cholesterol particles. And they should be kind of large and light, like ping pong balls. You don't want small, dense little BBs. So let's talk about pre-diabetes and diabetes. So my mentor in heart attack prevention is Dr. Brad Bale, who started doing heart attack prevention years ago before anybody else was doing it. And he and his nurse practitioner, Amy Doneen, who actually has a PhD, wrote a book called Beat the Heart Attack Gene, and they feel strongly that 70% of heart disease in this country is driven by prediabetes and diabetes. And that brings us to visceral fat, which is fat in and around your internal organs. So there's so much heaviness around the middle these days in people in this country, and also worldwide as we export the SAD, Standard American Diet, throughout the world. So if you are a male and you have a waist circumference of 40 inches or greater, or a female 35 inches or greater, and you measure your waist circumference not at your belt size. If you're a middle-aged man, for example, and your belly hangs over your belt size means nothing. So you measure at the area of greatest circumference, which is around where your belly button is above your hips. So if you meet that criteria, male 40 inches or more, female 35 inches or more, and a lower cutoff, by the way, in Asians and East Indians, that means you've got visceral fat. And also, if you just don't even meet those measurements, but you look at your profile in the mirror naked, and you have even a little bit of a belly, you still probably have the same problem. And the problem is visceral fat, which is in and around your internal organs, and fat in your muscle cells and the cells of your tissues. And that kind of fat causes insulin resistance, where your tissues can't use insulin like they should. And so your pancreas tries to make up for that by making more and more insulin over the years. And eventually your pancreas wears out. And finally, your provider, on the basis of a fasting blood sugar that's high, says, well, you've got diabetes. But the problem is that pre-diabetics get the same problems that diabetics get: the eye problems, the heart problems and strokes, the kidney problems, and the nerve problems. So it's important to diagnose this very early when it can be reversed. So heart attack prevention are always looking for pre-diabetes and diabetes and treating it and trying to reverse it when we diagnose it. So another sign that you have this, what we call insulin resistance / prediabetes, is if your triglycerides are even a little bit high, even a little over 150, and your HDL or good cholesterol is on the low side. By the time the fasting blood sugar goes up, it often is too late. Now, what we do in heart attack prevention is, if we suspect somebody might have this insulin resistance, we do a 1 and 2 hour glucose tolerance test. That's the gold standard. And so you fast for 12 hours, you can drink water, but nothing else. And then you go into the lab and they give you a bottle of something very sweet to drink that's got 75 grams of sugar in it. And then 1 and 2 hours later, they check your blood sugar. And the 1 hour should be less than 120, and the 2 hour less than 125. So I'm going to show you what insulin resistance looks like. So this is Michelangelo's statue in Rome of David, and he's looking pretty buff. You know, he's been on the Mediterranean diet for a couple hundred years. Not the ideal diet, but a pretty good diet. And he's looking pretty buff. And then they take him on a tour of America, and that's how he comes back. So you can diagnose prediabetes from 20 feet away. Now let's talk about sleep apnea. So at altitude where we live, over 6,000 feet, we see a lot of central sleep apnea, although the most common kind of apnea throughout the country is obstructive sleep apnea, which occurs particularly in people that have that are overweight and that have kind of thick necks and who snore. And so when they go to sleep at night, their tissues relax, and that causes obstruction to the airflow in the upper airways to your lungs. And often it causes irregular breathing, and your bed partner says that they wait for seconds before you start breathing again after you stop for several seconds, that kind of thing. Central sleep apnea is a little different. So your body, if you're at altitude at nighttime, especially if you're older, your body senses that there's not enough oxygen in the air. And it tells you to take several deep breaths in a row. And then what happens is you blow off too much carbon dioxide, and your body says, don't breathe for several seconds. So you're going in and out of this deep sleep all night long, unbeknownst to you. So that's central sleep apnea. So anybody with heart in the arteries should have a screening test for sleep apnea. And that's very simple and inexpensive. And you just wear a thing on your finger that checks your pulse and records it and your oxygen saturation all night long. And if that's totally normal, it's unlikely that you have sleep apnea. If it's normal, if it's abnormal, then you probably have sleep apnea, and you have to take the next step, which is to get an overnight sleep study, which can be done at home or it can be done in a hospital. The treatment is Cpap, which is a little machine that's very quiet that you wear a mask over your nose, and it's positive pressure that comes out of the mask, and just the airflow is at a positive pressure. And it makes you breathe if you stop breathing at night. And most people tolerate it fine. For people that just don't tolerate it, sometimes surgery or dental appliances can help. So here's what a normal artery looks like. So you can see the endothelial lining is nice and thin, and there's plenty of room for the blood to flow in what we call the lumen. This endothelial lining should stay at 0.5 millimeter thick throughout life. And these people in the blue zones, for example, who are heart attack proof, that's the way their endothelium is as they age. It stays at 0.5 millimeter. Here is an artery that's diseased. So you can see the endothelium is thickened and plaque has developed in the wall of the artery. Now, 99% of our plaque is in the wall of our artery, not causing a blockage. And that's why stents, and 86% of the time when you have a heart attack, it's because that plaque that's in the wall of the artery ruptures, and it's the blood clot that forms that blocks off the blood flow, causing death to part of the heart muscle, and 20% of the time, as I said before, death of the patient. So 86% of the time, that's how heart attacks occur, not where there's a blockage. And so that's why stents and bypass surgery really are not useful. Have never been shown to improve quality of life or prolong life, except in the setting of an acute heart attack. Now, if you are having a heart attack, and an interventional cardiologist puts a stent in the blockage caused by this clot, it can save your heart and it can save your life. But in other situations, it's really much safer and certainly cheaper and better to choose lifestyle and reverse your heart disease in that way. And take medications if you need to, like statin drugs, to lower your LDL or bad cholesterol. So how do we diagnose heart of the arteries? So an EKG is not really helpful in most circumstances. And even a stress test isn't. Now, there is a caveat here. So sometimes people can develop slow growing, like 90% blockages in their arteries that don't cause any symptoms unless they walk up a hill or walk rapidly 20 feet or so. And then they get what we call angina, which is chest pain from lack of oxygen to part of the heart muscle. And if you push yourself hard enough, like climb a mountain, and you had that kind of a blockage, could be another cause of a heart attack, which is much more rare than the plaque rupture. So stress tests can pick that kind of problem up, but they don't pick up the other plaque that's in the wall of your coronary arteries. And even arteriograms, which are X-ray pictures that cardiologists like to do of the coronary arteries, they don't even pick up the plaque that's the 99% of the plaque that's in the wall of the arteries. So in heart attack prevention, we use two methods primarily. So one is a carotid Imt, which measures the thickness of the lining. So remember I said before that if your arteries get stressed, the first thing that happens is the lining gets thicker and then you develop plaque. So carotid Imt is a 10-minute non-invasive sound wave picture of the carotid arteries in your neck, which are just under the skin, so they're easily accessible. And they measure the thickness of the lining, and they measure whether or not you have plaque, and they also tell us whether the plaque is soft plaque that hasn't been calcified yet, and that's the more dangerous kind because it's less stable, or it tells you if you have calcified plaque that's been there longer and is more stable and less apt to rupture. The downside of the carotid Imt is that it's your coronary arteries your carotid arteries instead of your coronary arteries. But there's a 95% correlation between the two. So that's usually what I start out with. And then if somebody has a lot of risk factors and their carotid Imt test is normal, then I assume they could be in that 5% group where there's not a correlation. And then I order a coronary calcium score, which is done at most hospitals and freestanding imaging centers. And that tells you, it's a CAT scan of your heart. So it involves a little radiation, which the other test doesn't. And it tells you how much calcium you have in your coronary arteries, which is another way of saying how much calcified heart of the arteries you have. Now, the problem with that test is, especially in younger people, you can get false negatives because their plaque hasn't been there long enough and it hasn't become calcified. And then if we happen to see plaque on like back x-rays, for example, done for other reasons, then it's another way to diagnose the problem. And then symptoms such as angina. So let's talk about prevention of heart attacks. So we want to talk about the power of food to cause, the power of food, bad food to cause disease, and the power of healthy food to prevent, treat, and even reverse disease. So I like this saying by Ann Wigmore: the food you eat can either be the safest or most powerful form of medicine or the slowest form of poison. So that means if you're eating as SAD, standard American diet, you're slowly poisoning yourself. Dr. Esselstyn calls heart of the arteries a foodborne illness, and he says that most Americans have it because of the SAD, standard American diet. So what does science tell us is the healthiest diet? Well, The National Institutes of Health, after reviewing all the literature, concluded recently that doctors should consider a plant-based diet for all their patients. So here is an obviously overweight doctor telling his patient, or asking his patient, are you eating properly and getting plenty of exercise? So, you know, doctors only tell their patients to do what they do themselves, although this guy's an exception. So don't go to an overweight doctor. So let's talk about what a plant-based diet is and what you should be eating every day. So it's important that you eat a variety of vegetables every day, including greens and including cruciferous vegetables. So cruciferous vegetables are things like cabbage and kale and cauliflower and broccoli and Brussels sprouts and bok choy and radishes and watercress and a few arugula and a few others. Foods with intense color are particularly healthful, such as greens and radishes and peppers and sweet potatoes and carrots and tomatoes, and also foods with intense flavor, such as herbs and spices, are particularly healthy. And then eat fruit. So half of what you eat every day should be a variety of vegetables. You also should be eating fruit, but not fruit juice and not very much dried fruit, because dried fruit is concentrated sugar, and fruit juice shoots your blood sugar up really rapidly. But if you eat fruit, like let's say an orange, if you eat that, it's what we call a low glycemic index food. Because of the fiber in the fruit, your blood sugar doesn't go up much at all, whereas with fruit juice, it shoots your blood sugar up. So with fruit, intense color is also important. And so that would be like blueberries and raspberries, strawberries, blackberries, goji berries, any kind of berries. Also things like mangoes or watermelon. And then eat whole grains. So the key thing you need to know about whole grains when you go to the grocery store is to look at the serving size and see what the number is for total carbs, and see right under that is the number for grams of fiber, and you want that ratio to be 5 to 1 or less. So for example, with my favorite bread is Ezekiel low sodium bread. And the number for total carbs is 15, and the number for fiber is 3. And so you multiply the fiber number by 5, so that would be 15. 3 times 5 is 15. And if that number is the same as or greater than the number for total carbs, which was 15, then you're good. That means that that product has a lot of fiber and a lot of whole grains. Now you also have to look for the number for sodium and which is salt and sugar, but I get the low sodium Ezekiel bread that has 0 salt and 0 sugar. You want to eat legumes every day. So legumes are beans or chickpeas, lentils, and split peas. You also want to eat a handful of nuts every day, and they should be raw instead of toasted, because if they taste too good, you eat more than a handful. And they should be unsalted. So walnuts are the best. So the deal is that all nuts have good and bad fats, and walnuts have the best ratio of good to bad. Walnuts can be kind of expensive, like at the city market where I live, but if you go to Costco or natural grocers or Whole Foods, you can get them in bulk, and they're quite cost effective. You should be eating seeds every day. So get some unsalted sunflower and pumpkin seeds and put them on your salad. And for 2 reasons. One is that you get healthy fats that way, and the other reason is that the fat and the seeds help you absorb the fat-soluble vitamins in the greens in your salad. You want to eat herbs and spices. Remember at the beginning I said that food with intense flavor, which would be herbs and spices, are particularly helpful. especially turmeric, which is a wonder spice. It helps prevent and reverse DNA damage, and raw turmeric works really well as an anti-inflammatory. How about vitamins and mineral supplements? So if you're eating a plant-based diet, you're going to be getting all the vitamins and minerals you need through the food you eat, which is the way we're meant to get these things. And I should say through the food that you chew. So we didn't really evolve to drink our nutrients, we evolved to chew our food, and the interaction of the food that we chew with the microbiome in our mouth and also the saliva in our mouth releases these wonderful health-promoting plant nutrients. Now, there are a couple of exceptions to not needing any supplements. So one is vitamin B12. So vitamin B12 is made by bacteria in dirt, and our water's treated these days. Our produce is pre-washed, so we don't eat much dirt these days. And you don't want to get low on vitamin B12. So be sure, if you're plant-based, to take 1,000 micrograms a day of B12 in supplement form, and it's best to get tablets and chew them. And also the B12 should be taken separately from other vitamins. It's absorbed better that way. And actually, it turns out that anybody, even if they're not plant-based, even if they're eating animal products, who's 50 and over should be taking a B12 supplement as well. And then we should be taking vitamin D supplements because most of us are low on vitamin D. So when human beings were evolving over millions of years in equatorial Africa with a lot of direct sunlight and running around mainly naked, they had D levels of over 100. The standard in this country is to have your D level over 30, and many Americans don't meet that level. So most of us need to be taking 2,000 units of vitamin D3 daily in supplement form. And then it's very important you get enough omega-3 for brain health, and a lot of people depend on seafood to get their omega-3. But if you're avoiding seafood, if you're vegan, then you don't have that source. So if you're eating a handful of walnuts a day and a tablespoon of ground flaxseed a day, which I didn't mention earlier, but under seeds, you should also eat I say 2 tablespoons, but one's probably enough of ground flaxseed a day. And I just put the walnuts, by the way, and the flaxseed on my oatmeal in the morning. But your body converts the flaxseed and the walnuts to omega-3. But it's so important that you get enough omega-3, and perhaps for genetic reasons, some people wouldn't convert enough of the walnuts and the flaxseed that it doesn't hurt certainly to take an omega-3 supplement. So not fish oil, which is often contaminated. It doesn't do what it was touted to do in recent studies, but vegan algae-derived omega-3, which you can buy at City Market locally here for 500 milligram capsules, is fairly cost effective. So, wait a minute. So let's just briefly go over what you should not eat. So you should avoid meat, which includes chicken. You ideally should avoid seafood if you want optimal health. You should avoid dairy, which includes cheese and yogurt. Although there are some yogurts that are made out of almond milk. One brand is Kite, K-I-T-E, Hill, H-I-L-L. You should avoid eggs. You should avoid oils of any kind. So people wonder about that because they hear that olive oil, and some people think they hear that coconut oils are health foods. But remember, a big part of this diet is to eat unprocessed food, and oils are processed. And so your oils are fats. So the food companies try to get people addicted to salt, sugar, and fat usually in the form of added oil. So oils are addictive and they're processed, and most of the nutrients are lost during the processing. So being a fat, there are 120 calories in a tablespoon of any kind of oil. And if you want to lose weight, you don't want those extra calories. So you're getting all those calories with very few nutrients because they're lost in the processing. Another thing is you want the omega-6 to omega-3 ratio in your blood to be about 1 to 1 or at the most 2 to 1. For most Americans, it's like 10 to 1 to 30 to 1. So way too much omega-6, way too little omega-3. And that abnormal balance creates inflammation and heart disease and so forth. You want to avoid refined food or processed food. So, for example, white rice is not good. You want to get brown rice instead, or even better, black rice, also known as forbidden rice. So the intense color thing even applies to grains. You don't want white flour tortillas. You want to eat corn tortillas. You don't want to eat white bread. You want to avoid sugar. So look at food labels and see how many grams of sugar is in a serving size and realize that 4 grams is a teaspoon. That way you can visualize it. And for example, in a can of soda, there are 10 teaspoons of sugar. You want to avoid pesticides and other environmental toxins. You want to avoid salt. And I mentioned before, you want to avoid calcium and others in vitamin supplements for reasons I mentioned before. So what's the evidence? First of all, there's epidemiologic studies. So those are studies where you look at a big population of people and see what diseases they get and what they die from. So the China study is an example of an epidemiologic study. It's the biggest study that's ever been done on nutrition. So Dr. Campbell, the lead scientist, found a few decades ago in China that the people who were too poor to be able to afford to eat animal products did not suffer from and die from the chronic diseases that we get in Western societies. You know, the obesity, the diabetes, the heart disease, the several kinds of cancer, dementia, et cetera, et cetera. In Norway in World War II, Norway was occupied by the Nazis, and the Norwegians have a high rate of heart disease because they have a very meat and dairy-based diet. And during the war, the Nazis kept those things for their own soldiers, and the heart disease in the Norwegian people just plummeted. After the war, they got those things back, and a couple of years later, their heart disease rate was right up where it had been. In the Korean and Vietnam Wars, they did autopsies on young soldiers killed in battle. And the Asian kids had no signs of any plaque, but the American kids had significant hardening of the arteries. And more recently, various societies have been studied in the blue zones, and one of the 5 blue zones is Okinawa, another is the Seventh-day Adventist in Los Angeles, who for religious reasons are at least vegetarians, if not vegans. Evolution, humans evolved over some 20 million years from tree-dwelling plant eaters. And the paleo people like to point out that eventually they became hunter-gatherers, but by then the human genome had essentially been developed. If you look at the jaw and the GI structures of human beings, they're those of herbivores, not carnivores. Lab studies, if you drip the blood of people who eat animal products on cancer cells in the lab, it makes them grow faster. If you drip the blood of vegans on the cancer cells, it kills them, gets rid of them. Another type of lab study is arterial studies. So they can hook you up to monitors and they can give you a stake and your arteries constrict. They give you some kale, and as I mentioned earlier in the talk, your arteries produce nitric oxide, so they dilate. But the most impressive kind of study are the studies that have shown that you reverse heart disease totally. So Dr. Pritikin proved this, and then Dr. Ornish over 30 years ago now, took people with these 90% blockages and did arteriograms on them to see exactly where the blockages were and how big they were, put them on the plant-based diet, also had them exercise and participate in stress reduction, and repeated the arteriograms a couple of years later, and nobody was worse, and most people were better. And in some of these people, the blockages totally went away on this program. Dr. Esselson proved the same thing at the Cleveland Clinic in 2 different studies more recently. So here's an example from Dr. Esselson's wonderful book called Prevent and Reverse Heart Disease. And so the study on the left is, this is the main coronary artery that's being looked at here in the heart. And so on the left-hand side, the lower half of that artery is very blocked. And on the right-hand side is the same artery in the same patient 3 years after just going on this diet. So there are other diets out there, certainly paleo, Atkins, blood type diet, keto diets, and the Mediterranean diet, but there's really no proof that those diets are helpful like there is for a plant-based diet. Now, the Mediterranean diet is certainly the best of those, but people on the Mediterranean diet are still dying from heart attacks and strokes, whereas they're not on a total plant-based whole foods diet. So let's just compare animal-based diet on the left to plant-based diet head to head. So, and animal-based diet is acidic, and a plant-based diet is alkaline. And alkaline is better. Inflammation plays a role in many diseases. An animal-based diet causes inflammation, and plant-based diet is anti-inflammatory, gets rid of inflammation. You want to eat a diet that is high in nutrients and low in calories. Which would be a plant-based diet. An animal-based diet is high in calories and low in nutrients. Both animal and plant-based diets have the macronutrients, the protein, the carbohydrates, and the fat. Those are the 3 macronutrients. But only plant-based diets have a lot of micronutrients. And again, especially the intensely flavored and intensely colored plant products. It's been shown through many studies that animal-based diet are linked to all these chronic diseases we suffer and die from, whereas plant-based diets prevent and oftentimes reverse these diseases. Now, fiber is really, really important for good health, and in particular, fiber feeds the health-promoting bacteria in our gut microbiome. In animal-based diet, animals have bones that hold them up, and so animal-based diet has no fiber. Plants have fiber that holds them up, and so that's where you get fibers through eating plants. Animal-based diets are linked to cancer, and the World Health Organization now lists red meat and processed meat, which are things like bacon, ham, and sausage and lunch meats. WHO says that these products are carcinogens, and plant-based diet prevents cancer. We talked about avoiding pesticides. So if you eat meat, you get 14 times the amount of pesticides and other environmental toxins, and dairy 5.5 times compared to eating plant-based diet at the bottom of the food chain. So if you eat at the top of the food chain by eating meat or seafood or dairy, you're going to get a lot more environmental toxins. And then let's talk about the environment. We're all concerned about climate change and so forth now. So raising a pound of beef has a huge environmental imprint compared to a pound of beets, for example. Then there are 5 body defense systems, and all 5 of them are harmed by eating animal products, and plant products and enhance all of them. These are immunity, angiogenesis, which is the forming of new blood vessels, the gut microbiome, stem cell regeneration, and DNA protection. And then if we are, we're concerned about COVID these days, of course, and there are all sorts of other viruses in animal products that are just one mutation away from jumping to humans. And that's another reason not to eat meat. If you look at the Asian wet markets, which is probably where COVID came from, where you have different types of live animals stacked one on top of the other, and urine and blood and feces are dripping down to the species below. And the other problem, of course, is factory farming in the United States and China, where you have 1 million chickens and living in one structure right next to each other. It's a good way for viruses to spread and to mutate. So these are some cows being led to slaughter, and one cow is saying to the other, "My only consolation is that by eating us, they're killing themselves." So we know what we should be eating. Why don't we change? Well, blame it on our dopamine. So dopamine is a brain transmitter made by the pleasure center of the brain, and it has some evolutionary importance, but it's a kind of a primitive system that can be hijacked by drugs and things like drugs such as narcotics, and also alcohol and nicotine, and also food. Fat, salt, and sugar are addictive, as I mentioned before. So if you're overweight, this is one way to look at it. Don't forget what you eat, so you need to eat a skinny person. This is the kind of pharmacy you should be going to. Just take one a day with, he's handing her looks like a cabbage. Just take one a day with tomato and cucumber. So a FARM pharmacy. So let's briefly talk about exercise, which helps prolong life, but more than anything, it helps maintain quality of life. So people should exercise aerobically at least 30 minutes a day, hard enough so you can talk but not sing. So if you can't even talk, then you need to back off a little bit. If you can sing a song, you need to go faster. For those age 40 and over, a lot of aging is loss of strength. So you start losing it at age 40. So people 40 and over, they need to do strength training for at least 20 minutes twice a week, such as kettlebell or light weights or rubber bands, that kind of thing. Now, what if you exercise every day, but you have a desk job and you sit all day? That's a problem. Our endothelium is a very sensitive organ system, the lining of our arteries, and it's meant to have us up and moving about periodically and our blood flowing. So get up and move about at least every 30 minutes, and or use a stand-up desk, which helps a lot. So some people say they walk their dog, and some people say they go to the fitness center and take the escalator to go and get there. Now, how about non-lifestyle treatments for heart disease? So statins can be life-saving. Statins have been out over 30 years. They're very safe. They're not 100% safe. They can cause some muscle aching in some people, and once in a while muscle weakness, and something called rhabdomyolysis is the most serious thing that can happen even if you're not on statin drugs. There's slightly more apt to happen on statin drugs. So rhabdomyolysis is where your muscles break down, and that can clog up your kidneys, and that's a big deal. But it's extremely rare. So when I start somebody on a statin drug, I tell them to let me know if they have muscle aching or muscle weakness. But they can be lifesavers because ideally you want your total cholesterol less than 150 and your LDL less than 50. And certainly the diet I've been telling you about will help you do that, but some people need both statin drug and the diet. The diet, though, is 98% effective at least for preventing heart attacks, whereas statin drugs are only 30%. So diet's 3 times more effective, but as I say, some people need both. Zetia is another drug. So statin drugs work by preventing your liver from making so much LDL, bad cholesterol. Zetia prevents absorption of cholesterol, so it's not a statin drug. So that's another option. And there are a couple of other options out there now as well, which are much more expensive. People who have plaque probably should be taking a baby aspirin every day. People who have normal arteries, the risk of probably outweighs the benefit, the risk being stomach bleeding or more hemorrhagic strokes or blood vessel breaks in the brain. So why don't doctors tell you about this? Well, they don't learn about it in medical school. And then doctors get the same influence from big pharma and big food as the rest of us get, and advertising and so forth. So doctors just don't get it yet. It took them a long time to get the tobacco was bad, but once they got it, they really got it. So you hardly ever see doctors smoking these days. But believe me, doctors do not understand healthy nutrition. But hopefully that's going to change. So here's what a few other people have said. So Sophia Loren, a famous Italian actress, said, the reason Americans are overweight is that they don't enjoy their food enough. So mindful eating is really important, which includes chewing rather than drinking down a smoothie. So for one thing, drinking down a smoothie, you can get a whole lot of calories in about 20 seconds. Whereas if you have to chew your food, you're going to feel after 10 minutes that you're getting full, and you won't eat as many calories. Dr. Esselstyn says moderation kills, and the Mediterranean diet is sort of a moderation diet, and that's what he's talking about, because on his diet, people are not dying from heart attacks and strokes, and there's still people dying from heart attacks and strokes on a Mediterranean diet. I think this next one is really big. Kim Williams is past president of the American College of Cardiology. And he studied all the different diets out there several years ago and decided to go on a plant-based whole food diet. And people asked him why he did that. And he said, well, I don't mind dying so much, but I don't want it to be my fault. So when somebody in that kind of position gets it, then I think that's really important because he's going to influence a lot of other people. Now, some people say, well, everybody in my family died from heart disease, and so that's going to happen to me. So it's just going to happen. I'm not going to worry about it. Well, we have a saying in medicine that genetics loads the gun, but environment pulls the trigger. So you may be born with a loaded gun, whether it's cancer or heart disease or whatever, but if you eat the right foods and exercise, the trigger's not going to get pulled. So you don't have to be a victim of your genes. So some tips. After 10 to 14 days, you lose your addiction to salt, sugar, and fat. Your taste buds literally change, and you really don't want those things anymore. After 28 days, you'll be so happy with your weight and your blood pressure, your blood sugar, and your cholesterol, and the fact that you feel better because this is a anti-inflammatory diet, remember, that you're going to be willing to stick with it. So instead of toxic hunger caused by food addictions and swings in insulin level and blood sugar levels, you'll experience real hunger based on the need for calories. Good dental hygiene is important because that's often the cause of inflammation in people. And remember, inflammation is a big risk factor for heart disease. So are there any guarantees that you're going to live a long, healthy life if you adopt this kind of a lifestyle? Well, I mean, there is this tombstone here that says, I can't believe I ate all that kale for nothing. So, I mean, no, there aren't any guarantees. There's some things that don't have anything to do with lifestyles, like some kinds of brain cancer, for example. But I think what most of us want to do is to stack the deck in our favor. I did come out with a book a couple of years ago called Enjoy Optimal Health, 99 Health Tips from a Family Doctor. It's available on Amazon. And I do free 1-hour consultations. People can reach me at this number, 379-5718. There's a program that's more incremental to adopt a plant-based diet. I personally recommend going cold turkey and just going for it 100% because you get rid of your addictions a lot quicker that way. But if you're interested in the incremental approach, this is the phone number you can call to talk to Peter Goldstein. There's a way you can get freshly prepared meals, plant-based meals, locally delivered to your doorstep for $11. Hopefully you learned something from this. Thank you very much. Okay, Rita, we're done. I can't hear you.
Greg, thanks very much. That was a very good presentation, and I hope people enjoy it. And we'll be sure that the recording gets to the folks that are needing to hear this information. So I'm going to stop the recording now.
Okay.
And again, thanks for your time this morning. Thanks for sharing with people the important information about heart attack prevention.
Thank you, Rita. Thanks for having me.